foot bones X-ray, normal foot X-ray. Normal foot X-ray, a foot bones X-ray shows all of the bones of the foot, including the cuboid and the navicular bone. An X-ray of the foot should show the articulations between the talus and the cuneiforms and between the cuboid and the cuneiforms. A similar X-ray of the feet will show the relationship between the navicular bone and the third metatarsal. A foot X-ray can reveal broken bones and dislocated joints. Normal foot X-ray, this X-ray can also help determine whether the joints are healing properly and whether the fractured bones are aligned properly. The X-ray can also help determine the outcome of surgery. This type of X-ray is useful for detecting cysts, tumors, and infection of bones later on in the process. Regardless of the reason for the X-ray, a thorough examination is important. Oblique X-rays allow doctors to see the interphalangeal joint and the phalanges better. They can also show structural status of the longitudinal arch. An oblique X-ray allows doctors to take a second look at the navicular bone. A foot X-ray also helps doctors detect bone fractures that are difficult to detect through other methods. Ultimately, the purpose of the foot bones X-ray is to determine the structure of the foot. The oblique X-ray is also important. Normal foot X-ray, it shows the lateral cuneiform and the fourth and fifth metatarsals. The talus and navicular bone are also a part of the foot that needs to be seen on the oblique X-ray. A thorough examination of the oblique X-ray is the best way to find a diagnosis. During the oblique X-ray, the phalanges and lateral cuneiforms are easier to see. The oblique X-ray also provides a better look at the navicular bone and the calcaneum. These oblique X-rays can help diagnose Lisfranc injuries, which are injuries involving the lateral cuneiform ligament and connects the metatarsals to the cuneiforms. An oblique X-ray allows you to see all of the foot bones, as well as the interphalangeal joints. It is also useful in diagnosing a fracture of the foot. Your doctor may be able to prescribe an orthopedic shoe or perform a surgical procedure to correct the problem. However, it is important to remember that oblique X-rays are not always necessary for diagnosing a fracture in the foot. An oblique X-ray is also a good way to see phalanges and interphalangeal joints. Normal foot X-ray, the second metatarsal should be lined up with the lateral cuneiform. A fracture of the Lisfranc ligament will make the foot unstable. This can be seen on a plain X-ray, but a doctor may need to perform additional imaging to rule out a fracture. In order to determine the extent of damage, an X-ray of the foot should be done at the time of weight bearing. Depending on the severity of the condition, the X-ray can be anteroposterior, oblique, or lateral. The X-ray of the foot should also show the bones that bear weight. The IR is parallel to the plantar surface. X-rays can also be taken in the oblique and dorsal views. The oblique view is ideal for a better look at the navicular bone, but is not required for this procedure. Besides being an important diagnostic tool, a foot X-ray also helps to diagnose various foot ailments. A good X-ray of the foot will show all of the bones in the foot. The central ray of the foot is perpendicular to the IR. Normal foot X-ray, it passes through the base of the third metatarsal and the fifth metatarsal, and is perpendicular to the ankle joint. It helps the doctor identify problems if they haven't already. This X-ray is also beneficial for determining bone growth in children. The X-ray will help determine the size of the bones in the foot, as well as the size and position of bones and soft tissues in the foot. A foot X-ray will show the interspaces between the proximal metatarsal and the third metatarsal. This information is vital for a doctor to diagnose fractures, or to treat conditions related to the feet. In addition to the interspaces between the phalanges, the X-ray will also show the interspace between the proximal and the mediolateral metatarsals. Normal foot X-ray, normal foot Xray, normal foot Xray.